Hi viewers, this is Dr. Shabir Khan with Watch and Know Eye Care channel. Today our topic is about squint or strabismus. Squint or strabismus is the same thing. It is a condition in which the eyes do not align properly. One eye turns inward, upward, downward, or outward, while the other one eye is aligned and focuses at one spot. It can happen all the time or at intervals. This usually occurs because the muscles that control the movement of eyes and the eyelid, the extraocular muscles, are not working together. As a result, both eyes are unable to look at the same spot all the time. It can also happen because a disorder in the brain means that eyes cannot correctly coordinate. Strabismus also makes binocular vision impossible, so it is harder for the person to appreciate depth perception. It is estimated to affect around 4% of the population in the world. Types of strabismus. Now I will tell you types of strabismus or types of squint. There are different types of strabismus. They can be described by the cause or by the way the eye turns. The following terms describe strabismus by the position of eye. Hypertropia is when eye turns upward. Second is hypotropia is when eye turns downwards. And next, eutropia is when eye turns inward. And next, ectotropia is when eye turns outward. These are types of strabismus. An early diagnosis of strabismus will enable more effective treatment. In the past, it was thought that after a critical period, strabismus could not be treated, but now it is treatable. While treatment up to age of 6 years is believed to be most effective, strabismus can be treated at any time according to the condition. Now, I will tell you signs and symptoms of strabismus in the children. The sign of squint is fairly obvious from an early age. One of the eyes does not look straight ahead. A minor squint may be less noticeable. Infants and newborns may go cross-eyed, especially if they are tired. This does not mean that they have a squint. Parents can check with their doctor. If a child has one eye closed or turns their head when looking at you, this could be a sign of double vision or diplopia and a possible squint. It is a good idea to see a doctor. Strabismus squint is normally either present at birth or it develops in the first 6 months after birth. Now I will tell you the causes of strabismus. These causes may be congenital, meaning a person is born with it. Number two, hereditary, or running in families, suggesting a genetic link. And next is the result of an illness or long sightedness. And fourth is due to a lesion on a cranial nerve. If the eye cannot focus the light as it comes in through the lens, this is known as refractive error. Other problem that can lead to strabismus is cloud, myopia or short-sightedness. Number two is hypermetropia or long-sightedness. And third is astigmatism, where the cornea is not curved properly or cornea is uneven. Or refractive error tends to make the affected eye turn inward in an attempt to get better focus. Strabismus that results from refractive errors tends to emerge later on, usually around the age of 2 years or older. Hydrocephalus can also lead to strabismus. Hydrocephalus is a condition in which too much cerebrospinal fluid builds up in and around the brain. Some viral infections, such as measles, can cause strabismus. Other conditions that can cause it include neuronal syndrome and some other genetic conditions. Now, next, I will tell you diagnosis and treatment. In children and babies should have routine eye checkup as they develop. If there are signs of strabismus, the physician or optician will refer a child to an ophthalmologist or optometrist. The ophthalmologist will properly use eye drops that dilate the pupils before the test is done, and Hirschberg test or Hirschberg cornea reflectors is used to assess whether the patient has strabismus. The ophthalmologist shines a light in the eye and observes where the light reflects from the cornea. If the eyes are well aligned, the light will go to the center of both corneas. If it does not, the test can show whether the patient has ectotropia, hypertropia, esotropia, or hypotropia. Some people may have more than one tropia at the same time. Now, here I will tell you treatment of strabismus. The treatment options are as prompt treatment reduces the risk of complications such as amblyopia or lazy eye. The younger the patient is more affected, treatment is likely to be. Treatment options include number first is glasses. If hypermetropia or long-sightedness is causing the squint, glasses can be usually correct it. Eye patch. One over the good eye, a patch can get the other eye, the one eye with the squint to work better. Botulinum toxin injection or Botox This is injected into a muscle on the surface of the eye. The doctor may recommend this treatment if no underlying cause can be identified and if signs or symptoms appear suddenly. The product temporarily weakens the injected muscle and this can help the eye to align properly. Eye drops and eye exercises may help is the next. And surgery is only used if other treatments are not effective. It can realign the eyes and restore binocular vision. The surgeon moves the muscle that connects to the eye to a new position. Sometimes both eyes need to be amputated and to get the right balance. Exercises. A standard type of exercise for strabismus is home-based pencil push-ups. Hold the pencil at arm's length around midway between the eyes. Look at the pencil while moving it towards the nose and try to maintain a single image of it. Keep moving pencil toward the nose until you can no longer see it as a single image. Hold the pencil at the closest point where a single image is possible. If you cannot regain a single image, start again. A study of patient who did two sets of 20 push-ups each day of 12 weeks suggested that exercise can an easy, cost-free, and effective therapy. Other home exercises for strabismus include swimming in the mirror. It is another type of exercise. And in this way, the last procedure of correction of strabismus is the surgery. With surgery, squint can be corrected and eyes can be aligned, and in this way, a patient having a squint can see good and enjoy life with aligned eyes. Thank you. See you again. Bye bye.